All right, well, I have 9:17, so let's go ahead and get started. Good morning, everyone. If you saw the opening remarks this morning, then you know I'm Marty Rosendale, CEO of the Maryland Tech Council. Welcome to the Digital Transformation Summit and our opening keynote presentation, Security in a Digital World. Our focus this year is on the new normal and how businesses are using digital transformation to adapt. The Maryland Technology Council is the industry trade association representing the technology and life science industries throughout Maryland. Together with our members, we're improving the business climate in Maryland and helping companies that save, secure, and improve lives around the globe. Before we get started, I have just a few housekeeping items. Your microphones right now are on mute. However, you will find the chat and Q&A features at the bottom of your screen. You can use those throughout the discussion this morning if you have questions or comments that you would like to make. I will be monitoring both the chat and the Q&A as we're going through this discussion. That way I can incorporate some of your comments and some of your questions before we get to the Q&A section of our presentation this morning. This presentation is being recorded and will be made available for others to watch or listen to in the future. So thank you again for joining us this morning. My guests today are Robert Head, Vice President, State, Local, and PAC Affairs, Lockheed Martin Government Affairs, and Dan Dunkers, Chief Information Officer at Johns Hopkins Healthcare. Gentlemen, thank you so much for joining me this morning. We appreciate your time and your support.
Thanks, Marty. Glad to be here.
Yeah, thank you, Marty. It's a pleasure.
Yeah, my pleasure. So if you would, each take a minute, introduce yourself. Tell us a little bit about how you got to this point in your current position, if you would. And Robert, why don't we start with you?
Great, thanks, Marty. Well, it's great to be here with everyone in this digital environment. Marty, my career, I grew up in Texas, and I interned for my hometown member of Congress. And once I graduated, I moved to DC to work for her full time and worked for her for about 10 years. And spent a lot of that time as her chief of staff. And I came to Lockheed Martin in 2009 to work on the legislative affairs team. And I've been doing that since. The majority of my time I spent supporting programs in our key interests before Congress. Over the last almost 2 years, I've moved into this role where I still work with Congress at a strategic level, but I manage our state and local government practice, so to speak, and I'm our PAC treasurer and manage our political action committee as well for the corporation.
Great, thanks, Robert. Dan? Dan, I think you're on mute.
Thanks, Marty. Glad to be here. Sorry for the little snafu there. I started out my career with Arthur Andersen, and my philosophy when I graduated out of college was if I started with a firm like that, I could just move anywhere within the industry. And that really turned out to be true, as they really did a great job in training people and educating them on technology. From there, I went into manufacturing and spent many years in the manufacturing environment, and then transitioned over to healthcare because the two had such in common. And I say that in tongue in cheek because they're pretty different. So I ended up in healthcare. I went to spend some time with Care First Blue Cross Blue Shield. I went on to Nationwide Better Health, and most recently Kaiser Permanente, and now with Johns Hopkins. So a lot of who's who in the local healthcare space. And I did have one piece of advice for those who are looking to climb the corporate ladder. And that is, I chose roles very carefully in my career in making sure that I gained access and experience to all areas of IT. And so that led me to the role that I'm in now, leading a rather large team and having sole responsibility for IT. Thanks, Marty.
That's great. Thank you. So, gentlemen, this conference is about digital transformation and our future. So tell us, what does digital transformation mean to you? And Robert, back to you with that one.
Well, thank you, Marty. Digital transformation for Lockheed Martin is a corporate imperative. And we actually started this journey well before the pandemic, but of course the pandemic has accelerated it. And really for Lockheed Martin, it means two things. I think in the, in the big picture of things. One, it's moving all of our HR and IT processes and tools completely into a common digital world, which we're well on our way to accomplishing. The second thing is really how we operate as a business, how we do what we do. And we call that rapid transformation. So we're moving our engineering, our production, our software development. I know some of you probably know the term, agile software development. That's obviously an imperative for us. And manufacturing, and then procurement processes and sustainment, all into a common digital world. And that really is the core of digital transformation for Lockheed Martin. And the key for us is speed and agility, and of course, cost reduction to our primary customer, the federal government and Department of Defense. Like I said at the very beginning, it's an absolute imperative for us. It's a top priority, something we're putting a lot of time and energy and resources towards. And I would say that for the entire aerospace and defense sector, this is where we're all moving. And it's really the price of doing business, or the entry point, frankly, in the future. I mean, it is the future. And you've got to transform digitally to be competitive in this business.
Dan, what does digital transformation mean to you?
Marty, in healthcare, digital transformation is being driven by the need to provide improved and tailored care to a member, really when and where they want it. And so this really requires an investment in data analytics. There's new CMS rules around interoperability between payers and providers. The need to increase data sharing with members in new ways that have never been seen before, and new ways to deliver care, as well as adoption of things like telemedicine, home drug dispensaries, monitoring people at home, as well as expanded use of wearable data. So all that can generate better care plans for members and more tailored care plans for members. Secondly, Marty, I would say it's not just a digital thing. There's also a human element to this. New technologies are coming about in order to do all this. So our workforce has to change and adapt and learn new things, as well as finding efficiencies in the business. So Marty, it's really about gaining those efficiencies that Robert talked about. It's the new technologies that can add strategic advantage, as well as how it transforms the workplace and workforce.
Dan, your comments about delivering healthcare to customers and consumers is a good segue into my next question, which is, both of your organizations have played amazing roles in the response to COVID-19 and the pandemic. And I'm curious how the pandemic has impacted your organizations. Dan?
Yeah, so I would say that it's been quite the change in a couple different fronts. And I'll mention telemedicine, for instance. Telemedicine pre-COVID didn't really have the adoption across the industry, but as hospitals and care providers were forced to really just treat the COVID patients, well, what about all the other conditions that everybody was having? And so, if you wanted to see a doctor, the only way to do that was through telemedicine. So telemedicine then had a huge, probably exponential increase in acceptance and use across the industry. So that's the first thing. It's also had a major impact on the workforce. Most organizations had to go remote. And so if you didn't have a good workforce, working from home policy, that required a lot of changes in the HR policies. We actually had a very liberal work from home policy. And so for us, it was rather easy in that, we just transitioned to working from home rather easily over a couple of weeks span. But there's many organizations out there that really struggled with that, not only providing the technology, the bandwidth, but having the workforce, be able to do that. And how many Zoom calls have you been on where Somebody has either a dog barking in the background or a child crying or something of that nature. So the whole idea of a meeting face to face and the new normal for meetings is really come into play, as well as Zoom fatigue. And then lastly, Marty, I would say that it's been interesting in that there's been people that used to print out paper. For every meeting, managers would carry around these binders of paper, and their secretaries would be, prepping them for the day. And wow, they've had to go paperless because they can't do that anymore. So, it's been interesting in that regard. But also, some people, to be honest, really like the time that it took them to, get from work to home. And most people nowadays, that transition is just a few steps away. And so, how do you make that transition from being on all day at work to, having that work-life balance and separating work from home? So, for us, it's been a real emphasis on wellness and work-life balance.
Yeah. I have to say, it's been a challenge for me to go paperless, but I have learned how to use a teleprompter pretty well over the course of the last 13 months. So Robert, how has the pandemic impacted Lockheed?
Well, thanks, Marty. In many, I would just echo a lot of what Dan said. I mean, we've had a very similar experience. Our challenge, though, however, as a major manufacturer, with 114,000 employees, was how do you transition to the digital virtual world very quickly, which we had to do, and who transitions to that world and who doesn't, and how do you manage that, and how do you make sure these two new worlds you've got as a major manufacturer work together? So we, of course, didn't have as liberal policies, I think, on the virtual telecommute front as Johns Hopkins did, but we transitioned very fast and changed policies and moved very quickly. I was actually really surprised and impressed with how quickly we moved and how efficient it was. Obviously, with some bumps in the road, but we had to move about 50% of our workforce to the telecommute world, and the rest had to continue to go in. So the first and top priority was the health and safety of our employees that had to continue to go on site to labs, to production floors, to continue to build things that had absolute requirements that didn't change for the federal government and our allies around the world. Those who had to go into classified spaces, which you could only accomplish in person in SCIFs. So we moved quickly to create a very comprehensive workplace safety protocol, a very comprehensive medical and wellness program, which we built on top of what already existed. And we had to do this across 50 different jurisdictions, right, in the States, and then, of course, different jurisdictions around the world. So a very complex problem. And I'd say the biggest thing is, moving forward, obviously, the new normal won't be what it was pre-COVID-19. So we're in the process of planning for the future, and what does that workplace of the future look like for us? And I think digital transformation is a key aspect of that. It'll enable us to have a more efficient new normal that incorporates a virtual element with a lot of our workforce. But we'll also continue to be a traditional manufacturer that requires people to be on site and do what we do. So digital transformation, I think, is just even more important, and it makes it that much more critical for us to transform as fast as possible across the entire enterprise.
Yeah, it's been interesting. It hasn't been that long ago we were having these discussions about how do we go virtual. It was just 13 months ago we were facing the lockdown and looking at that. And now the conversation has shifted into how do we emerge, and what is that going to look like, and how many of our employees do we require to come to the office, and how often, and how do we deal with immunization and all of those factors. So as the pandemic has driven us all into this digital world, we've certainly seen an increased need for cybersecurity. So I've got a two-part question for you. And the first part, and I'll start with you, Dan, and that is, what role does security play in effective and efficient digital transformation?
Marty, it plays a critical role. In the news nowadays, you're going to see the solar winds attack, which is one could consider the largest cybersecurity hack in history. Most recently, there was a Microsoft Exchange hack where organizations, big and small, are being targeted. And ransomware can take out an organization for months, and it's been known to do that in our own marketplace. And so really, it's not a question of will you be ever a victim of an attack, but really when. So the organizations really have to plan properly, and you'll be judged on how well you mitigate and how well you prevent a hacker from doing damage within your environment. And how do you respond? Now, the interesting thing with healthcare is that there's this ever increasing need to share and have data real time to members and providers. And so it's interesting, you have this dilemma about keeping data secure, but then you also have this whole notion of data privacy, in that members want to be able to share data between providers, and if they move from one payer to another payer, be able to move their data, and really that drives the whole industry to be more efficient. You no longer have to get repetitive tests as you move between doctors, as doctors can see the results of tests from one exam to the next. So security is key to all of that. And it's an interesting dilemma, because data privacy and data security really have to play hand in hand. But it's, in some cases, Marty, what I consider, and I could freely share my health record to everybody, but my wife wants to keep it secure and private to herself. So it's, how do you design systems that have that flexibility? So, consent management is key to health industry, and making sure that that's across all communication channels. So it's quite extensive, and very important that data security is part of your transformation plans.
So Dan, I'm curious, just to build on that a little bit, because you talked about privacy and security. If we were able to get security right, if we could secure our data, is privacy still a big issue?
Yes, because it's easy to secure your data, I'll say, because you could lock it up. You could provide no access to the data whatsoever. You could take your systems off the internet. You could essentially isolate yourself from the internet, and hence you're really secure, and your only enemy is really from within. However, that's not the case. Privacy in healthcare is really driven by the HIPAA rules. So there's the Health Insurance Portability and Accountability Act, which really talks about an organization's need to be able to keep data secure, but yet where can you share it? So as you think about your need for, in the healthcare environment, to go from one doctor to the next, and that doctor being able to see your information, it's not just the security, it's the privacy, and making sure that people can share the data from a member perspective, when they want and where they want and with whom they want.
Mm-hmm. Great, thank you. So, Robert, a good friend of mine is a senior engineer at Lockheed Martin, and I have a sense that how seriously Lockheed takes security, digital security. When you were talking about the transition that even Lockheed had to go through with respect to the pandemic, what was the management of security like during that transition, and how is it impacting you today?
Well, I think that aspect of it didn't really change, given that, security is job number one at Lockheed Martin or any major aerospace and defense company, and we have, very important rules and guidelines that we follow. And all of our employees, come to work, when they come to work for Lockheed Martin, understand how important security is. And many of us with security clearances have, oaths that we've got to uphold to protect information and abide by those critical guidelines for our national security. So the challenge for us was one of, how do we continue to operate in that world when we're going virtual? So that's why our protocol to protect our people was so important, so we could continue to operate in classified spaces, not only in our facilities, but with, partner company facilities. We've got many of those kind of arrangements, and also with our customers in the national security space. So, but I would say that, in the digital transformation age, security is just that much more important, because you're moving all of your processes into one common digital thread, and obviously those are high interest, and so you've got to do everything you can to protect them. And so cybersecurity is at a premium, and it's nothing more important to us, frankly, as a corporation. So we spend a lot of time and energy on cybersecurity, not only for ourselves to protect ourselves, but obviously in the customer environment, or from a external perspective, we're very active in cybersecurity. And just to highlight, because we're a Maryland audience here, and Maryland's where we all live, Maryland is ground zero for cybersecurity. And as you know, Marty, better than anyone. And for Lockheed Martin, it's, we've got a cybersecurity center of excellence, and we're growing that workforce, obviously around the Fort Meade area, but in other parts of the state. So it's job number one, always will be. But I think, you've got to transform your models and your methods to adapt to this digital world in new ways. But as long as you do that, I think obviously you can manage things in this new world. So lots of challenges, but it's critical.
Great. So Dan, I want to come back to you with the second half of this question. I had an opportunity to present to a group of executives that are in the cybersecurity space a while back, and I was surprised when one of them pulled me aside and said to me that a lot of cybersecurity companies don't consider themselves tech companies, because so much of what they do is about employee behavior, not about the tech. So my question is, what role do our employees and customers have with respect to establishing and maintaining a secure digital environment?
Marty, I totally agree with that. And if you do some research on really what's causing a lot of the security hacks and ransomware attacks, I once read that 70% of all successful ransomware attacks really start from a successful email phishing attempt. So somebody gets an email, says, "Hey, you have you won the lottery. Click here to log in and get your prize," and somebody succumbs to that, and so obviously then you have credentials given up, and the hacker can come in and do whatever they want to their environment. So for us, we spend, and we just purchased a new product that helps with educating all of our employees on phishing attempts. And it's quite interesting. It does a really great job. We get great reports, but it really starts with educating employees on what these things look like and the impacts that could happen across the organization. And then secondly, Marty, on the customer side, nowadays you have to think of your customers as just an extension of your own business. And so for us, the same security protocols and measures and policies that we adhere to, we also have those same standards for our customers. In a lot of cases, we're sharing data with them for business purposes, and there's agreements in place for all that. But they have to be and treat our data and our members' data just as critical as we do, and with the utmost importance. And so there's all kind of protections in place. So again, it's something that employees and our customers are, it's utmost important that they are part of that digital environment and secure.
Great. Hey, I want to remind our audience to please use the chat room or the Q&A function if you have comments or questions you want to ask while the discussion is going on. Gentlemen, we talked about the new normal at the opening of this session, and I know that's an overused phrase, and people are probably tired of hearing it. But the fact is, as we come out of this pandemic, it's going to be different than we looked going into it. So I'm going to put you on the spot a little bit, ask you to get your crystal ball out, and tell us what you think that future might look like. And Robert, I'll start with you.
Thanks, Marty. Well, I think just in general terms, the future is going to be a hybrid, right, from the way we used to live and work compared to what we've been, experiencing over the last 12 months. Because I think there's, while the digital world has proven to be super efficient and effective, and we, people have been able to operate and work in ways that I don't think many of us fathomed 13 months ago. I think there's this real yearning to get back to human contact as well, and get back to some of what we've lost in this environment. So I think we'll see probably more of a combination and more human interaction and more interpersonal interaction in person in the future, maybe than a lot of folks have suspected. That being said, I think this virtual world, from how we work and interact with each other, is here to stay. So many things will be done virtually that 13, 14 months ago would have been done in person, I think, long into the future. So I think we'll just continue to refine, how we operate in this virtual world. I think flexibility is the key term, right? I think we're going to live in a much more flexible working world than existed before. And so I think companies and organizations have to make flexibility the center of everything they do for their workforce. I think there'll be an expectation of that flexibility and a different lifestyle that the younger generations will expect when they come into the workforce, because they're growing up in this very different time than many of us did. So I think it'll be a combination. When I look at the topic from a business perspective of digital transformation and what the future looks like for our corporation and others, I think it is the future from it just can't be avoided. Either companies will have to adapt and move into the digital world and the common digital thread, or they'll, be in danger because, the last 13 months has sped up this process and supercharged it, but companies will have to adapt and move into the digital world and transform. So for our sector, it's an imperative, and it's got to happen. And so I think that future is, and it's here. Mm-hmm. But, I think really at the end of the day, I think the biggest thing I've learned from this is just how quickly we can adapt, right, when forced to, and how much change has occurred. So, we were already in an age of great technological change, and that process, I think, has been sped up, significantly over the last 13 months. So I'd expect that the rate of change will continue at a faster rate than it did before as well.
Yeah, that's an interesting observation, that the rate of change will continue at a faster rate. We certainly did adapt quickly to this current environment, and to think that we're going to be faced with an even faster rate of change going forward, it might get a little bit exhausting. We need to keep an eye on that. Dan,
yes, that's true.
Dan, what are your thoughts?
So a couple things. The healthcare industry is moving away from what's called a fee-for-service model to really pay-per-performance from a provider perspective. And so that's really going to drive the industry into tailored care, custom care for individuals and members. You're going to find that mapping of the human genome is just going to be, bring new advances in the way we treat patients And also, you're going to find that there's just not one way of treating diabetes. Marty, I could have a different diabetes care plan than you or anybody else, and so it really will be tailored. And medicines that work for me may be different than medicines that work for you on the same issue. And so you're going to find that with the advancements in analytics, machine learning, and AI, as well as research in the genome and so forth, that we're really going to be able to tailor care for members and improve the health and well-being. The other issue that you have, Marty, is that there's other factors that come into, for instance, in healthcare around social determinants of health, whether people live in a food desert, let's say, and then how do they have access to healthy foods, and do they have access to be able to exercise freely and so forth? Can they walk their dog at night without fear of all the security in place? And so you really have to take all of that into consideration when you're looking at the care of members. And so I think with the improvement of analytics and all the machine learning and AI that's out there, you're going to see a lot greater advancements in medicine. Secondly, just from a pure security, because we've talked about security a little bit during the call, there has to be greater tools to detect and then react to intruders on your network. It is a full-time job for people to really search and hunt these folks out once they get in and really understand the damage that they're doing and really monitoring data that's going in and out of your network. So the tools are really going to have to get tuned in on that. And there's going to be investment. Unfortunately, when you go to a CFO and say, we've just got to invest in security, that's not the most flashy thing to do when that may not be providing competitive advantage for the organization. But it's more or less the table stakes that you got to invest in to make sure that you actually have an organization to prosper in the future.
Mm-hmm. Great, thank you. So we have a couple of questions in the Q&A section, but before we get into that, gentlemen, is there anything that we have not covered this morning that you would like to bring up? Robert, anything that we didn't cover that you'd like to bring up?
No, I think it's a great conversation and look forward to the Q&A.
Dan, how about you?
Yeah, I was just going to bring up the impact to the workforce and how, just the new technologies that everybody has to learn and really making sure that people take that in consideration. And then lastly, I would say that, if you have a choice between doing a project right and really making it secure and so forth, or do you skimp out, I would do it right the first time, because it's really hard to catch up after the fact. So
I'm going to take the moderator's prerogative and ask the first question, because you triggered a thought with me, Dan, when you brought that up. And that is, in your minds, is digital transformation an event, or is it a continuous process? Dan, what are your thoughts on that?
Well, I think it's no question a continuous process. Technology evolves. So not only technology has to evolve, but your workforce have to evolve. So there's a continual adaptation of both the organization and employees. Just not only keeping up, but what can you do to gain that competitive advantage? So it's continual.
Robert, do you agree with that?
Yes and no. I think it's both. It's obviously a continuous process, and I completely agree with that sentiment. But I also think, at least for our industry, it's an event, because it's a major transformation event that has to occur for that continuous process to actually, to enable that continuous process moving forward. So I think it's both, actually.
Interesting. Great. Thank you. So the first question from our audience this morning is, so many people joined us because they wanted to learn about digital transformation and how to implement it. And the question is there a platform for senior workforce members to use in order to get up to speed with internet and digital security versus having to research and study it on their own? Are either of you aware of a good platform, or maybe put a little bit differently, the best way for a senior leadership team to educate their staff on these issues?
So Marty, I'm aware of some Azure tools that are out there that my team is going through now that are open to just anybody, and they're self-help tools. So I think and you can go out to Microsoft Azure and look those up. There are tools from LinkedIn and various organizations like that that also have a lot of training materials on these topics. So I would take advantage of a lot of that.
Thank you. Robert, any additional thoughts?
Yeah, I don't think I have anything to add to that. Just because I don't have the the experience on that front of actually because we do all of ours internally, obviously. We've got a robust capability there. So I think Dan's probably got a better sense of that than I do.
So the next question is kind of interesting. I think this pandemic has been really hard on small companies. And the next question is, have your organizations been doing things intentionally to support smaller businesses throughout this pandemic?
Marty, can I take that one first?
Sure.
Because as a large company, right in the Fortune 50 category, our supply chain and our small businesses are our lifeblood. And we can't do what we do without thousands of companies across the country and actually all over the world. And so one of the first things we did when in March, when the pandemic hit and we went to this new normal, is that we made some key decisions to support our supply chain. And I'd say over 60% of our supply chain is in the small business category. So we began paying invoices early. And so since March of last year, so for a full year, we paid invoices early to the majority of our supply chain and all of our key programs to keep their cash flow. And especially because our supply chain is also so linked to the commercial aerospace industry as well, which has been hit so very hard. We felt it was critical to make sure that we were, accelerating payments to them weekly to keep them afloat. And it's been gotten a lot of testimonials from a lot of companies that just to describe to us how important that's been to them for this last year. And it's something we were proud to do, but also there was an imperative for us because we needed to keep that supply chain healthy and alive to continue to deliver for our customer. So I think that's the biggest thing. And we also created a number of tools to help small businesses interact with the federal government, to help them understand how to receive assistance from the government, with the multiple stimulus, plans that have passed Congress. And so we really took on a role frankly, it was our responsibility as a major prime contractor to be a resource and help them make it through these last 13 months.
Mm-hmm. Dan?
Marty, I would say Johns Hopkins takes our status within the Baltimore community very seriously. And within the DMV, we do everything we can to not only support the community, but the members within it, as well as small businesses. And so, there are programs not only for small businesses, but for minority-owned businesses and so forth. So it's something we take very seriously.
So I want to take a minute and address and give kudos to both of your organizations for your response to the pandemic, because from my perspective, Johns Hopkins stepped up in a big way, providing information, clinical information, epidemiology, just to help the world navigate this. Lockheed Martin stepped up and offered logistics support and I'm just everything that I think your leadership team at Lockheed could imagine they could provide in the way of support to businesses and getting through this pandemic. You guys put out press releases announcing your support. So from my perspective, I think you guys are being a little bit modest. because both of your organizations have done amazing things and continue to do amazing things, helping everyone navigate this pandemic. Dan, the next question is directly to you, and that is, what are your technical priorities in data privacy for 2021?
Well, that's an interesting question. The government has, in our lines of business, so we're in Medicaid, Medicare, and we have some DoD business as well. There are mandates in each of those lines of business, both from CMS and the DoD, that is keeping us very busy as far as meeting those, both from a security perspective and just from interoperability. So there's the CMS Interoperability Act, which allows patients to download their, through an API, download all the information that we have for a member. And then there's also rules around price transparency. There's the No Surprises Act. There's the provider directory. So it's really, for this coming year, a whole lot of our effort is spent on just regulations that we have to abide by. So it's quite a big part of our business.
Great, thank you. There is a comment that came in through the Q&A that I can't resist passing on, and that is how frustrating it is with respect to security, having to deal with complex passwords that we can't remember, having to log into VPNs, having to change our passwords on a regular basis. This can all get pretty frustrating for employees sometimes. So, gentlemen, I think we're up to the end of our time. So I just want to take a minute and thank you both. This has been a tremendous conversation. I really appreciate it. This is Marty Rosendale, and I've been talking this morning with Dan Dunkers and Robert Head from Lockheed Martin and Johns Hopkins Healthcare. Gentlemen, I really appreciate your time. I appreciate everything that you and your organizations have done for Maryland and frankly for the world throughout this pandemic. Thank you so much.
Appreciate it, Marty. Glad to be here.
Yeah, thank you, Marty, and it's great to have been on this panel with Dan. And I think this just shows Maryland has a lot to offer the world. We're really blessed with some great organizations.
Great, thank you. And thank you to all the audience for joining us this morning. Enjoy the conference.